everyone, and welcome to Arthritis Talks, Eat Smart for Arthritis. I'm Dr. Sean Bevan, Chief Science Officer at the Arthritis Society, and it's very nice to be here with you again today. For those of you attending your first Arthritis Talks, welcome. We receive dozens of questions daily about nutrition and how your diet may or may not affect your arthritis. Our expert today, Lalitha Taylor, is a registered dietitian from Alberta who has extensive experience working with people living with arthritis, and we really do look forward to being able to share this information with you today. Before we get started, just a few logistics. This webcast is best viewed on a laptop or a desktop computer. If you have any technical issues, please email arthritistalks@arthritis.ca for assistance. If you have a question for our presenter, you can submit it through the Q&A. In most cases, you'll need to click on the Q&A button in the bottom middle of the screen to do so. We'll try to get to as many questions as we possibly can during the hour that we have together. You can click on the chat icon in the bottom middle of the screen to access the chat and connect with other participants as well as the Arthritis Society's chat moderator. If you'd like to close the chat completely, please do go ahead. Just click the red X icon to close out of the window. We're pleased to continue to provide open captioning of our webinars to accommodate the diverse needs of our audience. And you'll see that running along the bottom of the page. Many of the questions we received followed similar themes, so we'll address those first before we get into a live Q&A. Before we get started, I want to just take a moment to thank our event partners, Pfizer, United Way Winnipeg, Novartis, and our other sponsors for their financial support of our Arthritis Talk series. Now let's get started. Welcome, Lalitha. First of all, let's start with some basics. Why is having a balanced diet so important for someone living with arthritis?
So thank you, Sean, so much for allowing me to be a part of this session. One of the things that when we think about arthritis from a personal standpoint, I was actually diagnosed with arthritis when I was 19 years of age. And so I know how significant nutrition and lifestyle can make a difference when you do have arthritis. So when we think about nutrition, it not only impacts our physical health, but it also plays a role in our mental health. Without proper nutrition, we're prone to nutrient deficiencies. So when we're not eating well, we're not getting in the vitamins and minerals, maybe some of the macronutrients like carbohydrates and proteins that play a role in not just helping with creating tissues or fighting off disease, but also play a role in creating helpful brain neurotransmitters, which play a role in our mental health. Research has also shown that certain foods can lower inflammation. So some of these foods include omega-3 fatty acids, fiber-rich foods, nuts and seeds, and more. Balanced nutrition alongside physical activity can also help manage our weight. Weight management is especially important, especially if you have arthritis in your weight-bearing joints, such as your feet, your knees, your hips, and spine. I think a really important point to remember is that you don't have to change your entire diet. Even small changes can make a big difference.
Thanks for that, Lalitha. And we know it's so important to nourish our bodies properly with healthy food, especially when we're living with arthritis. So as a follow-up to that question, we do receive many questions related to whether there's a specific diet that people living with arthritis should particularly follow, or the flip side of that, are there specific foods that people with arthritis should be avoiding?
Those are both really great questions. And when we think about arthritis, there really is no miracle diet. However, research has shown that a diet rich in vegetables and fruit, fish, beans, nuts and seeds, whole grains, and low in processed foods that contain saturated fat, trans fats, salt, and sugar has been shown to help manage disease activity. So one of the styles of eating that really lends itself to lowering inflammation and helping with arthritis is the Mediterranean style of eating. This is beneficial in lowering blood pressure, preventing chronic disease ranging from cancer to diabetes. And some of you actually may have other chronic conditions in addition to arthritis. So this is why this type of meal pattern is ideal. It's very high in fiber, protein, and healthy fat, which we know will delay the release of sugars into the blood, which leads to greater blood sugar control. We also know the Mediterranean style of eating is helpful in curbing inflammation. It can help with weight management, which of course we know will help with joint pain, and it can also improve symptoms of depression. So an easy step thinking about moving forward with your nutrition is starting out with managing your portions using the balanced plate approach, according to Canada's Food Guide. So half of your plate, we want it to be full of those vegetables and fruit, and we want to focus on color. So dark green, bright orange, and red. Vegetables and fruit are rich in antioxidants, which may lower inflammation and slow damage to your joints. We want to aim for, at the very least, 2 colorful vegetables per day. So this could look like broccoli, spinach, kale, bell peppers, and butternut squash. We want 1/4 of your plate to be those healthy whole grains and starches. So this could look like barley, brown rice, oats, whole grain bread, and sweet potatoes. High fiber grains again play a role in helping to lower inflammation and manage that blood sugar control. The other 1/4 of your plate should be filled with lean protein. We want to focus again on fatty fish, some more of those plant-based proteins such as tofu, beans, nuts and seeds, and even poultry. Now, interestingly enough, when we think about that Mediterranean style of eating, we want to limit red meat. In fact, the Mediterranean style of eating encourages red meat only a few times per month. And then last but not least, I know this isn't pictured on the slide here, but we want to drizzle our plate with healthy fat. So this could be using olive oil as part of a salad dressing, or having sliced avocado or nuts and seeds on your plate. Your fluid should be mainly water or even milk, or a milk alternative to give you additional calcium and protein. We know that drinking more sugary drinks coming from things such as pop or juice can actually maybe lead to more inflammation. So the question, are there specific foods that I should eat for my arthritis? Now, when we think about arthritis, we're talking about over 100 conditions that affect the joints, tissues around the joint, and other connective tissues. So with that being said, there are foods, and we talked about that Mediterranean style of eating, that does lend itself to lower inflammation, better weight, and quality of life, regardless of the type of arthritis. And again, recommendations may differ slightly with certain arthritis conditions, but for the most part, the dietary principles are the same. We want to eat a diet that's really rich in vegetables and fruit, the whole grains, beans, nuts, soy, and olive oil, and really try to minimize our intake of foods that are very high in sugar, salt, saturated in trans fats. Now, diet is unique to each and every individual. So when we're thinking about our diet and we think about Canada, in 2016, over 250 ethnic origins or ancestries were reported by the Canadian population. So we incorporate different foods based on our culture and traditions. Some of us also have confirmed allergies or sensitivities to certain foods. So I know, for example, if I eat certain foods, like maybe even red meat, that may cause my joints to be a little bit more swollen the next day. So again, we want to take in all of these considerations when we're thinking about a nutrition care plan that is specific and unique to ourselves. Another point too that I want to make mention is because of certain medications, we may not be advised to take or consume certain foods. I'll use the example of methotrexate. So again, when you're on methotrexate, it's advised not to drink alcohol. Or if we're on certain medications such as prednisone, we might have to be very cognizant about taking in additional calcium. Focusing in on a diet that's rich in plant-based proteins, such as beans, lentils, nuts, and seeds, are associated with less inflammation and lower fasting insulin. So these proteins are very high in iron, fiber, magnesium, potassium, and folate. And all of these vitamins and minerals and nutrients are important for certain reactions in our body, for making sure that we have a certain synthesis of cells. Potassium is important in muscular contraction. We know iron is important in terms of preventing anemia. So all of these play a different role with our health. So how do we incorporate more plant-based proteins? I always encourage my clients, start with one meatless meal and then gradually incorporate 3 to 4 meatless meals per week. We also know that more processed plant-based proteins will have more salt and additives. So this may or may not aggravate your joints. So that's something that you have to pay attention to. People who eat nuts and seeds have less inflammation. Vitamin E is one component in nuts that can inhibit pro-inflammatory cytokines. We want to aim for a variety of different nuts, such as almonds, walnuts, pumpkin seeds, pistachios, peanuts, hazelnuts, and Brazil nuts. Raw nuts are less processed versus roasted. So we want to opt for those less processed nuts as much as possible and aim for about 30 grams per day. So 30 grams is about 23 almonds, but another hint that I learned from one of my colleagues is a serving is anything that you can put in your hand with your fingertips touching palm. That's about a serving of nuts right there. Another thing that we want to incorporate within our diet is more whole grains. So including more whole grains that are rich in fiber have a beneficial effect on inflammatory markers. A few studies have found that people who eat high fiber diets have lower levels of an inflammatory marker known as C-reactive protein. And we know that CRP, for many of you guys who have, for example, rheumatoid arthritis, is something that we are always on the radar in terms of controlling. High fiber foods also play a role in feeding that microbiota or that bacteria that live in our gut. We know that when we eat more fiber throughout the day, it also plays a role in helping us feel fuller longer or aiding in that satiety, which is such an important tool for weight management. We want to aim for grains or servings of grains that have at least 3 or more grams of fiber. So when you're looking at your bread, and this could be something that you guys try at home today, is when you're looking at the nutrition label on your bread, you want to make sure that your bread at the very least has 3 grams of fiber per slice. Oats and barley are a fantastic source of fiber, and they also contain something known as soluble fiber, which is really beneficial in terms of lowering cholesterol. Oats in particular, they contain many beneficial phytochemicals that have unique anti-inflammatory properties. Another important fat that we want to include in our diet is known as omega-3 fatty acids. Omega-3 fatty acids are essential, meaning we cannot create them from our body. We have to get them from our diet. Research has shown that a diet rich in omega-3 fatty acids may help with rheumatoid arthritis. We find omega-3s in fatty fish such as salmon, rainbow trout, herring, sardines, and mackerel. Now, I don't know about you guys, but in Alberta, salmon is really expensive. So a really easy tip that I encourage my clients to do is purchase wild canned salmon with the bones. And so just one can of that salmon will provide you with 2 servings. And it's such an economical and non-perishable source of that omega-3 fatty acid. And if you get it with the bones, then you're getting that additional calcium, which we also know is really important. Other sources of omega-3 fatty acids that are plant-based, if you don't like fish, include chia seeds, walnuts, and ground flax seeds, canola, and flaxseed oil. Now with flaxseed oil, we can't cook with flaxseed oil because it has a very low smoke point. So this is something that you would maybe drizzle on top of your plate, incorporate as a salad dressing. Now, I mentioned calcium already with the wild canned salmon with bones. Now, why is calcium so important? I wanted to include this because many of my clients that I see on a regular basis, I would say for the most part, don't get enough calcium in their diet. It is so important for us to meet our calcium recommendations because people with arthritis are at higher risk for osteoporosis, which is our bones becoming more frail and porous, and that means that we're at a greater risk for fracturing our bones down the road. We know that dairy is a good source of calcium, and not only that, the probiotics that we receive from yogurt can be beneficial again to that microbiota or bacteria in our gut, which can also play a role in lowering that inflammation. But if you choose not to have dairy products, or if you have a lactose intolerance, it's still really important that you include calcium-containing foods. So if we think about our cow's milk or even a milk alternative such as soy or pea protein milk, that would have about 300 milligrams of calcium per serving with 1 cup. So that's going to give you the biggest bang for your buck. Hard cheese, ricotta cheese, and yogurt would have about 200 milligrams per serving. That canned fish with bones, 1 serving is going to have about 200 milligrams of calcium. And we also know that our green leafy vegetables and almonds are also a very good source of calcium as well. Now, requirements, again, from ages 19 to 50, we need about 1,000 milligrams of calcium. If we're older than 50, about 1,200 milligrams of calcium. And again, this is something that I would pay close attention to because most people struggle with getting their calcium on a daily basis. And sometimes this is where a supplement may be necessary for you to reach that recommended amount. Now, I love this slide because when I think of this slide, it involves flavor. When we're adding more herbs and spices to our food, we're making our food more palatable. So including things like turmeric, basil, rosemary, cayenne pepper, cinnamon, and ginger contain some inflammation-reducing polyphenols. We want to use fresh or dried herbs or spices almost at every meal if possible. And I know people are like, how do I use herbs on my breakfast meal? Put cinnamon inside of your oatmeal. If you're having eggs, put some basil inside of your eggs or even rosemary. And this is such a great opportunity for us to reduce our salt as a seasoning at meals. We really want to try and move away from salt as much as possible. Now, one of the things I wanted to make mention of, now everybody and their dog, I think, has heard of turmeric, and I get lots of questions about turmeric. One of the things I would have you guys think about is if you are using turmeric, use it in moderate amounts and make sure that you're communicating with your family doctor and your specialist. If you are on certain medications like warfarin or Coumadin, for example, it may actually thin your blood a bit more. So you want to make sure you're always communicating if you're taking supplements or even herbs or spices in high doses to your practitioners. Now, that's such a great segue into this next slide, which is supplements. And we do want to be wary with supplements, especially when they promise a quick fix. They have claims that sound too good to be true. Maybe they're based off of a recommendation from a single study or anecdotal evidence. Maybe your neighbor Joe came over and said, hey, this cured me from, my joint pain in the morning. That may not necessarily be scientific evidence. We also want to make sure supplements are regulated, and they're also refuted by reputable organizations. So when we're thinking about regulation, all of your supplements should have something known as an NPN, which is a natural product number. And that indicates that that supplement has been tested to make sure there's not just filler inside of it, it's actually what it's supposed to be. So that NPN is very similar to a drug identification number, or a DIN, that you will find on medications. Now, determining whether or not you need vitamins and minerals, it really does need to be discussed with your trusted health practitioner, because some of this does depend on your age, your activity levels, your health, and your gender. So for example, I work with a lot of athletes, female athletes, who are more predisposed to iron deficiency. So I'm looking for that. With some of my older clients, I'm looking more at vitamin B12. So depending on where you're at in your stage of life, your vitamin and mineral requirements might be higher or less. Now, when we're thinking about supplements, the supplement industry is a multi-billion-dollar industry. And you really want to make sure that you're not sucked into this vortex of spending money on things that are unnecessary. And this is where you bring in that trusted pharmacist to ask whether or not you need to be on this particular supplement. I think one of the most popular questions I get from an arthritis perspective is, can I have Nightshade vegetables? Is that going to cause my joints more pain? So when we're thinking about Nightshade vegetables, these include eggplant, tomatoes, red bell peppers, potatoes. Now, when I look at this list of foods, I know that these foods are very high in vitamin C. In fact, red bell peppers have more vitamin C than oranges. They're rich in fiber. We know that cooked tomatoes, are very high in lycopene, which plays a role in reducing prostate cancer. So if we get rid of all of these vegetables, we're actually missing out on a very good source of other nutrients. Now, these vegetables contain a chemical known as solanine. This is what people have thought has caused more inflammation with individuals with arthritis, but there's really no scientific evidence to prove this. Now, for some of you, you may say, well, when I don't have tomatoes or when I don't have eggplant, my joints feel better. And that could be the case. Everybody is so unique with our chemical makeup. Now, if you're unsure about Nightshade vegetables, you can simply test it. So eliminate Nightshade vegetables for a couple of weeks and observe your symptoms. Then slowly reintroduce them back into your diet. So if you start to notice more pain and inflammation, then maybe you do need to limit your intake of these foods. For some people, like I mentioned, they may have a sensitivity to these foods. We're all made differently. Not all foods work the same in our bodies. But that sensitivity doesn't necessarily mean that it's going to be a sensitivity for others. So you really do have to test it. Another very common question I get is, well, what about gluten? Should I have gluten? So gluten is a complex set of proteins found in whole grains such as wheat, barley, and rye. Now, this is a reminder that gluten is found in whole grains, and we know whole grains are rich in fiber, protein, and B vitamins. Gluten acts like the glue that holds whole grains together. So if any of you guys have made bread before, you would have witnessed that firsthand. Now, if you do have a sensitivity or an allergy to gluten, this may cause more joint pain. And I have seen this with clients before and patients in clinic. But a gluten-free diet is very restrictive, and it's not a necessity if you do not have symptoms from eating gluten-containing foods. So this is really where you have to work with a medical professional like your doctor and registered dietitian to determine if you have an allergy or a sensitivity. So there's blood work that can be done to see whether or not you have an allergy to gluten, and the gold standard to determine that allergy would be an intestinal biopsy to determine if you have a confirmed celiac diagnosis. So again, you want to work very closely with your medical professional to determine if you have an allergy or if it's a sensitivity or if you need to stay away from gluten at all. Should I be drinking alcohol when I have arthritis? Now, many of the medications that your doctor prescribes to relieve your sore joints don't mix well with alcohol. So certain meds, when mixed with alcohol, they may increase your risk of stomach bleeding, ulcers. I'm thinking about maybe some of those NSAIDs, and even liver damage. So a great medication that comes to mind is methotrexate. Alcohol also is particularly problematic if you have gout. We know that beer is very high in something known as purines, which can increase your uric acid levels. Distilled alcohol and wine can also be problematic too. We also know that alcohol is calorically dense. It has about 7 calories per gram, which is more than carbs and protein. So it's an easy way to take in some additional calories. And on top of that, when you drink alcohol, it lowers your inhibitions and also your blood sugars, which makes you want to eat more. So if you do want to drink alcohol, I would encourage you to have a conversation with your specialist, your doctor, and see whether or not that's something that would be appropriate for you and your health. Another question that I often get too is sugar. What about sugar? Now, a 2018 systematic review reported several studies linked to higher sugar intake causing more chronic inflammation. And this was especially associated with sugary drinks. So individuals who have higher sugar diets have more inflammatory markers in their blood, that CRP, that C-reactive protein. So the Heart and Stroke Foundation and Diabetes Canada recommends you consume no more than about 10% of your total calories per day from added sugars, and ideally maybe even less than 5%. So if somebody was on a 2,000 calorie a day diet, that would look like about 12 teaspoons of added sugar. Now, I'm not talking about sugar coming from fruit or milk or yogurt. This is more, again, maybe sugar coming from pop or candy, cookies, etc. Now, speaking of which, in terms of pop, 1 can of pop contains about 10 teaspoons of that daily added sugar. So this is something that maybe some of you may need to reflect on, is to ask yourself, how much sugar am I taking in? Could this be one of the reasons why my joints are feeling a little bit more inflamed?
Thank you so much, Lalitha. You covered so much ground there with so many different examples. I know some of our audience has questions about particular things that maybe we'll come back to at the end of the live Q&A. For now, could we touch a little bit on how does somebody's weight affect their arthritis?
Yeah, thank you, Sean. That's such a great question. We know that having additional weight does add extra pressure on your weight-bearing joints. I remember when I was pregnant with my daughter, after I had her and I had additional weight on my body, I definitely felt more inflammation, especially in my feet. A key study published in Arthritis and Rheumatism of overweight and obese adults with knee osteoarthritis found that losing 1 pound of weight resulted in 4 pounds of pressure being removed from the knees, which is fairly significant. We also know that research has shown fat tissue creates and releases pro-inflammatory cytokines or chemicals. So by reducing those fat stores in your body, your overall body inflammation will go down. Less fat may also improve disease activity and increase chances of remission. Improved body composition has also shown to maybe contribute to less gout attacks. And we also know that studies have shown losing weight slows that cartilage degeneration and osteoarthritis. So how do we lose weight? And this is the big question. Losing weight, first of all, is not a behavior. We can't just rub our hands together and lose weight. It's a series of small behavior changes that result in better weight management. And I would argue if the focus is solely on weight loss, we start to forget about the other factors of health and well-being. Another thing to remember is losing weight is not easy, especially as you get older. And we often have really big expectations for weight loss. And it doesn't help if you have a clinician or a practitioner telling you that you need to lose 50 pounds before your knee surgery. I've been there with patients in clinic. I know how stressful that is. One of the things that we know also when we get that pressure for weight loss is we start turning towards diets. And dieting is actually the number one cause of an eating disorder, of developing an eating disorder. And I don't know about you guys, but I've counseled many individuals who have lost weight from a diet, gained weight back, lost weight from a diet, regained weight, and may have regained even more weight. So we know that yo-yo dieting not only damages our relationship with food, it can also lead to further weight gain. And when that weight is regained, it causes fluctuations in blood pressure, heart rate, and circulating levels of blood fats and insulin, which can actually increase our risk of heart attack and stroke. Now, I'm going to say this. 90% of diets do work, okay? They do. However, can you sustain it? That's the real question, right? Can you sustain the weight loss? It's far more important to incorporate small changes that move you towards better fitness and health than an extreme change that you can only follow for maybe a few months or a few weeks. So here's some positive news that I want you guys to take home is research shows that a weight loss of even 5% of body weight can help reduce inflammation. A really fantastic resource if any of you guys are interested in learning more about this, obesitycanada.ca has a lot of reputable resources and webinars on weight management. And when we think about our weight, there are so many factors that influence the way we are. So personal genetics. Even when I look at my sister and myself, our body fat deposition is very different. And I'm much taller than my sister. She's much shorter than I am. So genetics is very unique and specific to each of us. Our body composition. So males have more muscle traditionally than females. Our family history, our age, gender, if we have any medical concerns and conditions. So again, if I have some clients who have maybe hypothyroidism, that may be more challenging to lose weight when their TSH is not well managed. If you're on certain medications, that may cause weight gain. Shift work even causes an imbalance with our circadian rhythm, which may prevent us from losing weight or having difficulty with weight management. I often encourage my clients to reflect and ask, is weight the issue or is it a symptom of something else that's going on in your life? And usually unintentional weight gain and unintentional weight loss is a symptom of health and life being out of balance. So if you guys can reflect with me, and if any of you guys have maybe had some issues with weight, when did that weight gain occur? Was it when you were more stressed or anxious? Was it when you had more pain? Were you less active? Was it a time where you weren't getting enough sleep and feeling more fatigued? Now, I would also argue all of these little circles here, including your ability to prepare nutritious foods, they're interconnected Because when one of these things is out of balance, when you're experiencing more pain, it's going to impact all these other circles in your life, which make it so much more difficult for us to manage our weight. But again, this doesn't have anything to do with the weight. This is the root of the issue right here. So we really want to shift our focus from weight to overall health. We want to start taking inventory of your own personal self-care, which could include but not limited to physical activity. So we could start with aiming for 10 minutes up to 60 minutes per day. And you really want to talk with your physician, your physiotherapist, your occupational therapist to find out what exercises work for you and are appropriate. If you're having pain or inflammation that is preventing you from activities of daily living, I know even for myself, I worked with my occupational therapist to get appropriate orthotics for my feet, which allowed me to start walking and even running. So that made a significant impact in terms of my personal activity. You also want to participate in movement that makes you feel competent. So don't immediately dive into something that you have no knowledge about, unless you want to be super adventurous. But when you feel competent about that activity, it's more motivating. And again, you want to make sure that you're participating in things that bring you joy, because that's going to be more sustainable long term. We also want to manage our stress and anxiety. So this can be huge when it comes to flare-ups or inflammation. I know when I reflect on my life, my biggest sources of inflammation throughout my 20 years of having rheumatoid arthritis was when I was going through big transitions in my life and when I experienced a lot of stress. So this could mean talking with a therapist, maybe taking more breaks during the day, deep breathing, increasing that physical activity, because we know physical activity can have a beneficial impact on lowering stress and anxiety, ensuring that work and home life balance, and really reflecting, taking inventory of where you're at to make sure you feel like you have a purpose. When it comes to our nutrition, we want to just slow down and reflect and say, am I eating healthfully and mindfully? Am I paying attention to my hunger? Am I eating my meals without distraction? Do I have a sense of gratitude going into my meals? Does this meal or this food, does it satisfy me? Does it make me feel good? We really want to focus in on whole foods versus processed or convenience foods. And I had an individual the other day saying, well, even whole foods has some processing to it. Look at bread, that's somewhat processed. And you're right. I mean, even some whole foods have an element of processing. I would maybe add, we want to eat as close to the farm as possible. So the less processed, the better. As mentioned before, we want to follow that balanced plate approach to get the right portions of our nutrients. We want to make sure that we're watching our portions of grains and starches. I would say the majority of individuals that I counsel probably overeat on the carbohydrate portion of that plate. We want to increase vegetables because that's an area that we tend to undereat. And that's where we're getting all of those important antioxidants. We want to aim for that fatty fish, the beans and poultry. Eating regularly to prevent hunger going into meals. So most people need to be eating at least 4 times per day. So again, we think about our core meals, breakfast, lunch, and supper. Most individuals have the longest time span between lunch and supper. And again, if you're not feeding your body regularly, this could cause you to go into that meal feeling really hungry, which can lead to less intentional food choices and also overeating at that meal. Now, this is probably, again, another very underrated facet of our health, which is sleep. We really want to ensure we're getting sufficient sleep. National Sleep Foundation recommends at least 7 to 9 hours. Now, 80% of rheumatoid arthritis patients report fatigue as one of their symptoms. And I will attest to that. I have felt that symptom for sure. And I definitely know that when I get sufficient sleep, that helps me manage my disease activity. It also helps to manage stress. And when we are tired or fatigued, that's when our cravings for carbohydrate and sugar are much higher. Our body is so smart. Our body knows where to get energy from, and it's seeking easy forms of sugar, right? And so when we are well rested, we're going to make more intentional food choices. And I would also argue when we're well rested, we have more energy to be active. Now, another very important point, and again, that's why you guys are here. You want to manage your pain, right? And this is where you need to talk with your doctor and your specialist. Make sure you're checking in with them on a regular basis, making sure you're taking your medications as indicated so that your pain is well managed.
So you mentioned making small changes in the context of weight management. And we know that eating healthy can be challenging for some people. So maybe could you elaborate on some of the small changes that you would recommend people pursue when it comes to really making a difference in their overall health and, of course, managing their arthritis?
So I would have everybody pause right now and just take inventory of your current health and ask yourself, what is the biggest health priority? And for some of you, it may not be nutrition. I know that you're attending this seminar right now, but if you really take an honest look at your current health, maybe it's sleep. We're going through a pandemic right now. Maybe it's stress. That's the biggest health priority. Again, every single facet of our health is connected. So if you can identify your biggest health priority and start working on that particular facet of health, it will have positive ramifications on everything else that's going on with you. And you will also want to ask yourself, am I ready to make a behavior change right now? Not all of us are. We have so much stress going into our brain, many of us, that maybe we can't handle a behavior change at this moment in time. And that's okay. We have to show ourselves compassion. But ask yourself, if some of you guys are ready to make a behavior change, can you dedicate 10 to maybe 30 minutes per day towards that change? So that could mean 10 minutes of physical activity. Maybe it's 30 minutes of planning your meals for that day. Maybe it's 30 minutes that you're going to allot to stress management, right? But it's thinking about, do I have the time to carve out in my daily schedule for that behavior change? And then if we're thinking about nutrition behavior changes, if some of you guys are motivated to make that change, I'm going to reiterate, it could be using that balanced plate approach. So looking at your plate right here again, your hands are a really great guide for your portions. So again, about 1 cup or less for that carbohydrate, those whole grain starches. Now for some of you guys who are active, it could be more. Your protein should be about palm size, and your vegetables and fruit should be about half of your plate. Adopting a Mediterranean style of eating, again, the research shows that this pattern of eating is beneficial for all arthritis conditions. For some of you, it could be choosing less sugary drinks, maybe tapering down on the pop or even juice. Increasing that fiber intake. So again, for women, 25 grams of fiber per day, men 38. It could be sampling and trying out some plant-based protein recipes. Eating 2 servings of fatty fish per week to get in those omega-3 fatty acids. It could be including balanced snacks to prevent overeating at meals. It could be consuming more of those whole foods. So I know many of us are kind of getting into the mode of maybe takeout or more of convenience foods. So we could maybe transition more to experimenting with recipes and cooking at home more. Eating mindfully and without distractions. How many of you are eating in front of the TV and maybe not paying attention to the amount of food that you're eating and paying attention to whether or not you're feeling full? Identifying the foods that work for you and the foods that don't. So many questions came in about sensitivities. So again, it could be figuring out, does this cause me inflammation or can I keep this food within my diet? Increasing calcium-containing foods. Again, people with arthritis are more prone to having osteoporosis and maybe on medications that leach calcium from your bones. reviewing supplements with your trusted pharmacist to determine if you need them. And last but not least, definitely not least, book an appointment with your registered dietitian to create a nutrition plan that is unique to your needs. So, thinking about all of these behavior changes, is there one nutrition behavior change that you could implement today? So for example, and it doesn't have to be this one, this is just an example. I will aim to increase my fruit and vegetable intake. So again, you want to make that goal really specific. How are you going to do that? So it could be, okay, well, I'm going to have a fruit and maybe a handful of almonds for a snack in the afternoon. And then I'm going to aim to encourage my spouse to add more vegetables to that supper meal. And I'm going to grocery shop for broccoli this week so that we have those vegetables available to us. So you want to make sure that when you create this goal, it's very specific. I want you guys to remember, every single facet of your health is connected. So if one facet of your health is out of balance, whether it be your sleep, whether it be your bowels, whether it be your mental health, whether it be your nutrition, all of that, if anything is out of balance, it's going to affect something else. You are not alone. You need to seek the support of your healthcare team if you are wanting to really fine-tune and get specifics on what you need to do to move forward and come up with a unique plan. So again, it's talking with your specialist, making sure that you're connecting with your family doctor, the nurse in clinic, your physiotherapist, your occupational therapist, registered dietitian, pharmacist, and more. So I also want to encourage you guys to check out the Arthritis Society Facebook page. They share lots of information on healthy eating and life hacks.
Great. So before we get to some live questions, Lalitha, do you have any final thoughts or recommendations for our viewers?
I found this awesome quote, Sean, and it's by Bessel A. van der Kolk. And she said, once you start approaching your body with curiosity rather than with fear, everything shifts. So again, I really want to challenge all of you guys who are tuning in today to shift your mindset towards curiosity about your health. So be reflective and start figuring out what works for you and maybe what doesn't. And don't be hesitant to seek the support of a health professional.
Sounds like great advice. Okay, so I do want to get to some of these questions because we have lots of great questions in the Q&A. So let me just get right into it. We have lots of questions about sugars, and so I'm going to combine a few together. But Could you give some thoughts about when you're comparing cane sugar, honey, artificial sweeteners? Can you put some of all of that into context when you talked about the recommendations in this presentation? For example, Diet Pop as one example that people have been asking about.
Mm-hmm. That's such a great question, Sean. And I think when we're lumping our sugars together, not necessarily the artificial sweeteners, I'm going to speak to that in a moment, but our cane sugar, our maple syrup, our honey, all of those sugars will break down into glucose and cause our blood sugar levels to go up. Our body can't differentiate whether or not we're taking in table sugar or honey. And I think that's a big misconception that a lot of people think that honey is healthier maybe than cane sugar or white table sugar. But again, it's about that moderation and honing in on the amount of sugar that you're having throughout the day, because again, this is something that could increase inflammation. So all of these sugars have the same effect in your body. Now, when we're thinking about artificial sweeteners such as Diet Pop, what we know is when we're having lots of Diet Pop, for example, and there was a study that showed that individuals who drink, and we're talking large amounts of Diet Pop, I'm not talking about just one can here and there, it increased their cravings for real sugar at the end of the day. And so I would encourage individuals going back to that, very just simple statement of moderation and balance. It's okay to have a little bit of sugar, but too much sugar can lead to issues. Same thing with diet pop. If you want to have the odd diet pop, artificial sweeteners, sucralose, even aspartame in small amounts are not going to cause your body harm. Now, for some people, they will have a sensitivity to it. So again, if you do, avoid it. But if you want to have a diet pop every now and again, I think that's fine. If you're drinking large amounts of it, then we have to ask the question, are we drinking that because we're seeking energy? Are we wanting that caffeine? We also know that with certain diet pops like colas, they have more phosphoric acid inside of them. Caffeine and phosphoric acid can actually leach calcium from our bones. So we don't want to be drinking those types of fluids in large amounts because we want to maintain our bone health. And we also don't want to displace other helpful nutrients within our diet.
And so on the same kinds of line, what about non-alcoholic beer in particular? You showed a picture of beer, so I think that's why the questions are coming up relative to beer that has alcohol in it. Is there a difference?
That's a great question. And so non-alcoholic beer is usually about 0.5% or less of alcohol. And so again, with beer, especially if you have an arthritis condition known as gout, we know that there is a high level of purines in beer that can really exacerbate that gout and cause your uric acid levels to go up. So that's something that I may actually have to get back to that participant who asked that question, because I'm not sure if the purine level in non-alcoholic beer is lower. But again, going back to what I said with alcohol, it's a conversation that you need to have with your specialist, because if you're on certain medications that are contraindicated with alcohol, if it's going to cause an issue with your liver enzymes, you still want to tread with caution, especially if you're drinking maybe 2 or 3 servings of that beer. It can add up.
Mm-hmm. Okay, I'm going to keep on going down my list here. What about coffee?
So interestingly enough, we were talking about gout. For individuals who have gout, coffee has been shown to be beneficial in helping to manage some symptoms. People can have up to 2 to 3 cups, and that has actually been shown to be beneficial for gout. So that's something that is positive for individuals who like coffee. I would say with coffee, again, it's back to moderation, and it's also going back to what are you putting in your coffee? Right? So if you're putting in lots of sugar and maybe some of those creamers that also have sugar in it and some of those hydrogenated fats, then you want to make sure that you're having that coffee, and whatever you're putting inside of that coffee in very moderate amounts. It is something that I know a lot of people will turn to when they're feeling fatigued. I myself, I really enjoy coffee, but I am cognizant with the stuff that I put inside of it. And I do limit myself to 2 cups per day. Again, going back to what I said about the diet pops and even pops that are darker in nature that have caffeine, that will leach calcium from your bones. It's not healthy for your bones long term. And for any individuals who have an iron deficiency anemia, drinking too much coffee will also inhibit the absorption of iron.
Okay, so you just mentioned iron deficiency, and we have some questions here about if you're trying to reduce your meat intake to the benefit of your arthritis, are there any concerns there about maintaining your iron levels in your blood?
So the plant-based proteins that I mentioned in the presentation, lentils, black beans, all of those are going to be really rich sources of iron. Even tofu is a very rich source of iron. Now, the one thing that we are aware of with plant-based proteins is the iron that is present in these plant-based proteins is harder to get absorbed into the blood. It's a non-heme iron versus animal-based protein, which is heme iron. And so for some individuals, if you transition completely to plant-based, it's not a bad idea to get your blood work tested to see where your iron levels are at, especially if you are an active individual who runs or participates in a lot of sport. So that is one thing that I do advise my clients if they transition to more towards plant-based eating is get your iron levels checked. That's a great way just to assure that you're on the right track with getting sufficient iron within your diet. But there's lots of great resources out there that will outline where you're getting your iron from in terms of plant-based proteins. And my best advice is to have iron at every single meal as much as possible and combine it with a really good vitamin C source like oranges or red bell peppers to increase the absorption of that iron into your blood.
Okay, so we have a few questions here about food preparation. So, steamed versus raw vegetables, even frozen vegetables, even putting fruit in smoothies, things like that. Does any of that change from a nutrition perspective, the value of those foods?
I would say the one method of cooking your vegetables that may deteriorate the quality of the nutrition is boiling. So when you're boiling your vegetables and then you're discarding that water, many of the potassium, some of the nutrients are actually leached into the water. And so if you're using a soup and you're keeping that water or a stew, then you're getting the benefits of that nutrition right there. But boiling is probably one of the most taxing on your vegetables. Steaming is a great way to cook your vegetables. Roasting your vegetables is another fantastic way. Now, in terms of frozen vegetables, a lot of people think that frozen vegetables and fruit are an inferior source of nutrition, but they're actually picked at their peak and then flash frozen. And so we get a lot of nutrition from frozen vegetables and fruit. Again, it depends on if you're really boiling those vegetables to the extent that you're kind of leaching more nutrients out of them. I usually steam my frozen vegetables and they come out perfect. Putting frozen fruits into smoothies, I think is such an economical and easy way of getting more nutrition into your diet. So absolutely put frozen vegetables even into your smoothies too.
I need to ask about one more specific food that's on my list. What about chocolate?
Ooh, what about chocolate? So we know especially dark chocolate has some beneficial properties in terms of antioxidants. And I think, again, it goes back to moderation. So I know for myself, I really enjoy a couple pieces of chocolate. If you're having, let's say, lots of chocolate throughout the day, again, it's being curious about that behavior and reflecting on what am I using this chocolate for? Is it for energy? Is it maybe for emotional reasons? So again, if you're just having small amounts of chocolate, I think that is completely fine. It should not impact your arthritis. But if you are having large amounts of chocolate and you're wondering why this is happening, it could be that you're seeking energy from that chocolate, or maybe you're using it to help cope with some emotions, perhaps.
So we have a few viewers that I think are curious about the paleo diet. So do you have a point of view about whether that impacts people's arthritis positively or negatively?
Oh, the Paleolithic diet. Okay. So this is a diet that's definitely heavier in protein, I would say. And the emphasis would definitely be that animal protein and not necessarily plant-based. Now, as I mentioned before, everything that we do with our nutrition is so unique and specific to ourselves, right? And so if that's something that you're interested in exploring, try it. See if it makes a difference with your joint health. Now, the one thing with the Paleolithic diet is that we have seen individuals who consume higher amounts of animal protein, especially red meat, that can lend itself to higher levels of cholesterol. And you're taking in higher amounts of saturated fat, which we know those high levels of saturated fat can affect inflammation. But again, our chemical makeup, who we are, is very unique. So if this is something that interests you, try it and maybe even get the expertise of a dietitian to help you make that diet work for you. Try it for a period of time and see if it works. I think that the biggest thing, Sean, is when you're thinking about things like keto or paleo or even intermittent fasting, you have to remember whatever you do to control your health, you're going to have to continue doing for the rest of your life, right? So you always have to ask yourself that question, if I try this, is this going to be a sustainable way of living long term?
Yeah, that makes a lot of sense. I guess when people make these changes, do you have any guidance about how long people should expect to wait before seeing improvements in their arthritis, sort of before they go on to something else?
Oh, that's a great question. I think that's almost like $1 million question, because just again, speaking from experience, there's so many things that affect arthritis, right? So it could be stress, lack of sleep. And so to almost isolate one variable and do an experiment is hard. It is hard. But when it comes to our food, I would say for most people who do an elimination diet, we're looking at around 2 to 3 weeks. For some, it may take a little bit longer, but I think that's again where you solicit the guidance of a registered dietitian to help to figure out whether or not this is something that's meaningful for maybe you to pursue long term, or whether or not you need to include that food back into your diet.
Thank you for that, Lalitha. And I think I can ask you one last question, a very practical question. Many people liked your plate, your half the plate that you showed. Where can people find one?
Oh, that's a great question. So Walmart actually creates a corral plate that is divided into those portions. So that's a great economical place for you to get this microwavable plate if you guys aren't interested in that portion plate.
Perfect. Thank you so much, Lalitha, for sharing all your thoughts and your expertise with us today. That was fabulous. For our audience, the video and presentation slides will be emailed to all registered participants this week, and the recording of the webinar will be posted on our website very, very shortly. We'd like to take a few moments just to get your feedback on today's presentation. So most of you should see a poll question come up on your screen with a yes or no answer. So please do click on the response that reflects your thoughts. Did you find the information in today's webinar helpful to you? Yes or no? We will also be sending out an evaluation form when we send out the recording. So if you aren't able to access the poll question, or you'd like to give us some more feedback, you'll have that opportunity through that survey. We'll also use that survey to shape our future Arthritis Talks webinars, so we really do value your input. Once again, thank you to Pfizer, United Way Winnipeg, Novartis, and our other sponsors for their financial support of our Arthritis Talks series. Initiatives such as this webinar are supported by our valued sponsors and donors, including those who have generously left a gift in their will to the Arthritis Society. May is Leave a Legacy Month, and we encourage you to learn more about how you can plan a gift in your will to help continue essential programming like this long into the future. Visit arthritis.ca/plangiving to learn more. Our next webinar, Arthritis Talks Joint Surgery 101, is coming up on Thursday, June 17th. To register for that event, please visit arthritis.ca/arthritis talks. This concludes Arthritis Talks, Eat Smart for Arthritis. On behalf of all of us, thank you so much for joining us, and please do stay well.